Spring and sinusitis, how they affected with fibromyalgia. After months of cold weather that winter brings, many individuals welcome spring with open arms. It also involves for some of us stuffy nose, watery itchy eyes, sinus pressure, and headaches. It can also mean the breakdown of our defenses and we get tired of fibromyalgia for those of us. We don't know why, but it seems people with fibromyalgia have more problems with chronic sinusitis than others do. With a cold or a virus, it's like never going away. One study found that nose and sinus inflammation could be as crucial in patients with unexplained chronic fatigue or body pain symptoms of fibromyalgia as the gastrointestinal problems we experience. In other words, because our body is already on the highway of inflammation, it might explain why we get more tired with chronic sinusitis than others do. Knowing that there is an explanation and knowing how our sinuses are doing their work is useful because we are not afraid of what we know. How to fight with trifecta. We have 4 sinuses around our face and head, each connected to our nasal passages by small canals. The small hairs in our nose filters air as it enters our body, and our sinuses generate mucus that moisturizes our air passages so that we are protected against dust, microorganisms, and other unwanted invaders. Any blockages of allergens, bacteria, fungi, or other germs, such as polyps, nasal septum deviation, or swelling and inflammation interfere with the function of the sinus. Our archenemies do the same as spring comes: allergens, flying dust, and winds that dry up our air passages. Our sinuses can overreact and secrete surplus mucus that leads to runny nose and rhinitis, inflammation of the nasal passages, to keep up with the additional demand. Allergens also cause histamines to be released and we're off and running. Our air passages shrink like dried prunes and our sinuses feel like overfilled internal tubes that trigger sinus stress and headaches that often go hand in hand with fibromyalgia. So, what are we going to do? Because they also trigger rebound swelling, avoid overuse of vascular constrictors such as Afrin. Use a spray of the nasal steroid. Steroids reduce inflammation, but be careful how your body responds. These can also trigger symptoms. Over-the-counter sprays. Periodic use, as recommended by your doctor, of nasal saline rinse machines. Sprays of the nasal saline. They are mobile, and the nasal passages are hydrated. Antihistamines. If you know the reactions of allergens, be aware that antihistamines cause dryness, so hydrate plenty of water. Decongestants can help, but follow the precautions because some people should not use them. If reported, your doctor may offer steroid injections. Other issues may need to be studied, such as obstruction, allergies, yeast, or infection. Allergy testing. Endoscopy of the nasal. To look for defects, a scope made of flexible tubing with a camera at the end is placed in nasal passages. A CT scan or MRI, both provide imaging of sinuses not available with an endoscope. A culture of nasal secretions to look for pathogens such as bacteria or fungi. A consultation with a doctor of the ear, nose, and neck should be required. If symptoms get worse or different, see your doctor. Things may have altered, such as a physical barrier, the growth of fresh allergies, your environment, or other things we've talked about. Managing chronic sinusitis and any other known fibromyalgia overlapping circumstances not only enables us to feel better, but also provides us a feeling of empowerment because we can do something to assist ourselves. Please leave them in the remarks below if you have this issue or have questions. I love learning from you. Stay healthy. Thank you for watching this. Please do not forget to subscribe, share and like our channel. Click the bell icon for latest update.